So today we'll be talking about infertility in women. Hey guys, welcome back to Nicky At Your Cervix. It's your girl Nikki here, and if you're new here, welcome. Don't forget to hit my subscribe button, turn my post notification bell on so you can get an update every time I have a new release. And follow me on Instagram at Nikki_at_your_cervix for lots more interesting content. So what exactly is infertility? Well, a diagnosis of infertility means you haven't been able to get pregnant after a year of trying. So if you're a woman over 35, it means you have not been able to get pregnant after 6 months of trying. Women who are also able to conceive but cannot carry the pregnancy to term may also be diagnosed with infertility. You have primary infertility if the woman has never been able to get pregnant, and a woman who has had at least one successful pregnancy in the past and now they can't get pregnant again, we call that secondary infertility. So what are the causes of infertility? Female infertility can be caused by a variety of factors that affect or interfere with the following processes, like ovulation. So this is when the mature egg is released from the ovary. Another process is fertilization, which occurs when the sperm meets the egg in the fallopian tube after traveling through the cervix and the uterus. And another process is implantation, which occurs when the fertilized egg attaches to the lining of the uterus itself, where it can then grow and develop into a baby. So any process that affects these three can affect your fertility. And some risk factors include your increase in age. So women greater than 35 are at greater risk of being infertile. Smoking cigarettes, heavy use of alcohol, being overweight or obese or significantly underweight, having certain sexually transmitted infections or STIs that can damage the reproductive system. And here is a variety of medical conditions that can affect their fertility, and these include ovulation disorders such as PCOS, what we call polycystic ovarian syndrome, or hormonal imbalances, pelvic inflammatory diseases or PID, endometriosis, uterine fibroids, premature ovarian failure, scarring from a previous surgery. There are also some medications and drugs that can affect your fertility, and these include chemotherapy or radiation therapy medication, long-term use of high-dose non-steroidal anti-inflammatory drugs, or what we call NSAIDs. So long-term use of NSAIDs like aspirin, ibuprofen, Advil, etc. Antipsychotic medication, as well as recreational drugs such as marijuana and cocaine can affect your fertility. So if you believe you're experiencing infertility, you should go and get it checked out with your doctor. Your doctor first will take your medical history from you. They'll take a sexual history, a general history, to find out any condition or illness that can affect your fertility. Then they can perform examination of the pelvic area to check for any abnormalities like fibroids or conditions such as endometriosis or PID, and they would want to see if you're ovulating every month, so they can determine this by using an at-home ovulation testing kit or through blood testing at the office itself. They can also recommend an ultrasound to examine the ovaries and the uterus itself. Other common tests we can perform include a hysterosalpingography, which is basically a type of X-ray used to evaluate the fallopian tubes and the uterus. We can also use laparoscopy, which uses a camera to basically examine the inside organs. There's also something we call ovarian reserve testing, which uses a combination of hormone tests to determine if a woman's potential of conceiving, and this test can include follicular stimulating hormone tests. So we can run up a variety of tests to see what is going on. So as regards to treating your infertility, it all depends on the cause of your infertility. So the treatment can include surgery, medication, and reproductive assisted therapy such as ART. And it's important to note that sometimes you need several of these treatments or a combination to help boost your fertility. So you'd get surgery to correct any abnormality of your uterus, to unblock any fallopian tubes, or to remove any fibroids that may be impacting your fertility. As regards to reproductive assistance, this can include methods such as intrauterine insemination or the ART as I mentioned. During the intrauterine insemination, millions of sperms are basically injected in the woman's uterus near the time of ovulation. And the IVF, which is in vitro fertilization, is one type of ART assisted reproductive technology, and this involves remove the egg itself that are then fertilized with a man's sperm in the lab. After fertilization, the embryo is placed back into the uterus itself. And as regards to the medication used basically work like the hormones that are naturally present in your body, which either encourage or regulate ovulation. The bottom line is infertility affects a lot of women worldwide, and if you believe that you are having some issues with your fertility, you should just get it checked out with your doctor as soon as possible for them to find out what is causing this and give you possible treatment. So, do you have a problem with your fertility? And if you did have a problem with your fertility, what were the treatment that you used to help you to conceive? And that's it for this video. If you have any questions, don't forget to drop it in the comment section below as well. And don't forget to like, comment, share, and subscribe to Nicky At Your Cervix on YouTube for lots more interesting content. Until next time, see you soon. Bye!